Hi, it's Jessica Drummond here from the Integrative Women's Health Institute, and I am thrilled to be here today with my guest, Dr. Terry Wahls. Dr. Wahls is a clinical professor of medicine at the University of Iowa, where she conducts clinical trials. She's also a patient with secondary progressive multiple sclerosis, which confined her to a tilt-recline wheelchair for 4 years. Dr. Wahls restored her health using a diet and lifestyle program she designed specifically for brain health, and now pedals her bike to work each day. I love that. She is the author of the Wahls Protocol, How I Beat Progressive MS Using Paleo Principles in Functional Medicine, the Wahls Protocol, A Radical New Way to Treat All Chronic Autoimmune Conditions Using Paleo Principles. It's now in paperback. And her new book, which we'll talk about some today, the Wahls Protocol, Cooking for Life, the Revolutionary Modern Paleo Plan to Treat All Chronic Autoimmune Conditions. And you can learn more about her work at terrywahls.com. Hi, Dr. Wahls. It's my pleasure to be here. How are you?
Thank you for having me.
Thank you. So I wanted to talk to you about, our practitioners primarily focus on women's health conditions. We look at fertility, we look at chronic pelvic pain, chronic pain in general. And, what I'm seeing in the research we're doing with vulvodynia and the clinical work that I'm doing with things like endometriosis and interstitial cystitis is there definitely seems to be an autoimmune component that we can impact using autoimmune paleo kinds of perspectives from a nutrition standpoint. Do you have any experience, research? What do you think about that?
Well, for many years, I worked in the VA here in Iowa City with a therapeutic lifestyle clinic. And we certainly saw the number one reason for people coming to see us was chronic pain. Mm-hmm. And that could be from a variety of sources. So we had polyneuropathies, traumatic injury from war injuries and surgeries. And then we had autoimmune types of pain. And in my tribe of thousands and thousands and thousands of followers, I've observed that we have many, many women who have issues with fertility, issues with painful intercourse, low libido, pelvic pain, and vulvar pain. So, people report tremendous success at reducing pain, improving function, improving quality of life as they move along and embracing more and more of the concepts that I teach.
So before we kind of get into that detail, can you tell our audience in a bit of specificity, what is your protocol and how do you do it?
So I basically started out at first replicating what I did for myself. Which was a structured paleo diet, targeted vitamins, stress reduction in the form of meditation, self-massage, exercise, electrical stimulation of muscles, and an exercise program designed by a physical therapist. Then, as I began to use these, and that's what we did in our clinical trials, when I began to teach these concepts to the public, use them clinically, I had more of a public health perspective and really created a stepwise progress to go from the standard American diet, which is generally high in sugar, high in grain, very inflammatory. So we had a level 1 diet, the Wahls diet, a level 2 diet, the Wahls Paleo. I had a ketogenic version of the diet, Wahls Paleo Plus, and then I had basically the Wahls elimination diet, which was more restrictive in a different way still. And by taking that approach, we could bring people along at a pace that they were willing to come. So depending on the circumstance, for example, if I had somebody with rheumatoid arthritis, I would put them straight on to the elimination version of my diet, nut and seed free, legume grain free, and nightshade free. And that's a very tough diet. But the vast majority of folks, we'd start with level 1, which is gluten-free, dairy-free. I might also remove egg, ramp up the vegetables. And depending on if they were vegetarian or vegan, we would give them a vegetarian vegan program, or we'd give them the meat eaters version of that diet. And then I would move them along their clinical response.
Now, and do you find that, people with rheumatoid arthritis, they're experiencing pretty acute pain much of the time, so they're more motivated to go more quickly to that higher level diet?
Correct. They're more motivated, and in my experience, people who have an autoimmune problem involving their joints are more likely to have a lot of sensitivity to the lectins in nightshades. So they really need to remove the nightshades. They might tolerate occasional legume, but if we get the nightshades off, I ask them to get rid of the legumes and the grains as well. And then after they're feeling great, we can talk about what is it that they'd like to test to see if they could reintroduce on a sporadic basis.
Yeah, that's interesting you say that. I was actually working with a patient just this morning who has vulvodynia, and we essentially started with a gentle elimination diet, probably closer to your phase 1 or 2. Gluten, but not all grains, and in the first 2 weeks of her menstrual cycle, she felt great. She was ready to start coming off her medications. But then as, estrogen dropped prior to her cycle, she was noticing mild, less intense, but still there flares. And so I was thinking, as we were talking about just before, and I would love to talk about this a little more with your research brain on, I was looking at the research we're looking at with pregnancy is a Th1 to Th2 autoimmune shift.
Yeah.
And supporting that Th2 or reducing Th1 dominance, I'm beginning to think more lectin reduction for patients with pelvic pain.
Yeah, so a couple of things I'd be thinking about. Because of the intensity of the symptoms, reducing the lectins, reducing the nightshades, if they're open to it, I would do that more aggressively. And also think about estriol. That might be a very interesting thing to add. And you can get some estriol creams. So I wonder, might that be helpful?
Yeah, like topical estrogen. Yeah.
That might be helpful. Some of the phytoestrogen essential oils might be very helpful as they are ramping up their vegetables. You might see, could they tolerate more flaxseed puddings, chia seed puddings? Now, for some folks, the lectin in those seeds will be disagreeable, so that might work because of the phytoestrogen component, or the lectin component might make it a bigger problem. So you'll just have to be mindful as you introduce that. But that is one reason to think about some of the phytoestrogen essential oils. That might be another way around that.
That's really interesting. Yeah, I'm not really an expert in essential oils, but I'm starting to see that there's a real place for them in a lot of different things. I was just literally an hour ago looking at a clinical trial of aromatherapy with lemon oil and reducing morning sickness, essentially in first trimester of pregnancy. So there is actually some data there. Yeah,
there's some interesting data out there. There's certainly a long history of traditional use. And again, these are plant-based compounds. When I introduce essential oils to someone, like I do with many of my concepts, I let people know you're individual, you're unique, test this out, try and do just one intervention, start on Sunday, see how the week goes, and then decide this intervention was helpful or it was not. But it's much more helpful to do things gradually in a sequential fashion.
Absolutely. And so, the other paper we were talking about before, my client that was really successful with eliminating vulvodynia after kind of, stalling with years of physical therapy and psychotherapy, she also had IBS and really balancing her gut microbiome. Even though we used a vegan diet, it was still very low carb, very vegetable heavy, lots of healthy fat. And I'm wondering if you find that it's possible. You said you do use this sometimes with vegan clients.
Yeah, absolutely.
Challenging, yeah.
So I was a vegetarian 20 years, and I think my interpretation of the vegetarian diet probably added to my poor health. But it does give me a great deal of empathy for those who are vegetarian, vegan for their spiritual beliefs. And so I want to create programs that can work for them.
Yeah.
Plus, one of my research assistants was vegetarian for religious reasons. So for many folks, we can create a vegan version of the protocol. Occasionally, the lectins are a big enough problem that it becomes very, very challenging. Having said that, if you soak and sprout the gluten-free grains, gluten-free legumes, then that reduces the lectins.
Hold on just a second. I think we're having a little bit of connectivity issues. Let's try this again.
Okay, I'm back.
Good. Here we go.
So when do I have to start again?
You were saying soaking and sprouting the grains.
Right.
Yeah.
So if we soak and sprout, we'll reduce the phytates. That's a great thing. But you also reduce and inactivate a lot of the lectins. And for many folks, that will be enough. Now, the question is, how long do they have to soak? Is it 2 hours? Is it 6 hours? Is it 24 hours? That does depend on the grain or the seed. Flax, 2 hours will be fine. Rice, 2 hours will be fine. Your grains, 6 to 24 hours might be better. But if you soak them, drain, it won't take nearly as long to cook up that grain. And you then have a high quality protein, easily digested, more nutritional quality, and less lectin poisoning.
That's great. So I want to ask you a little bit more about how your protocol affects the gut microbiome and how that impacts really the neurologic, both components of pain, and also neurotransmitter when we're talking neurodegeneration.
Well, I'm sure all of your tribe knows that the research on gut-brain connection just gets more nuanced every year. And with basically all of our autoimmune conditions, you can search now, put in lupus, gut microbiome, and you'll see that scientists have identified a different microbiome compared with the person with an autoimmune condition and a healthy control. That's certainly true for MS. RA, lupus, scleroderma. I've not looked for any of the vulvodynia type issues, but I expect that would be the same. And the big driver in the food for a healthier gut is microbial accessible carbohydrates or resistant starch or fiber. All those words are fairly equivalent. We're looking for carbohydrate substrate that's going to feed things out. 9 cups of vegetables go a long way to increasing your gut microbiome. In our classes, we would have pooping in our chairs, and I would demonstrate pooping in the chair, turning around, looking at my poop, and describing finding rocks or finding a snake or finding pudding or tea, and what the response would be to get a healthier microbiome. And that we're all shooting for snakes. And basically, you don't need to spend a lot of money on microbiome analysis usually. You just need to look in the toilet and adjust the fiber, increase the fermented foods. And for some people, yes, you may need to do a microbiome assessment. But in the beginning, just have people look in the toilet and adjust the fiber and fermented food intake to get the snakes. That'll go a really long way.
Oh, definitely. I completely agree. Now, a lot of clients, so you're talking about, you've got a VA population, they're on a standard American diet when they meet in many cases. And a lot of our professionals in our student community are practicing in hospitals and traditional settings. So they're really dealing with the public who hasn't started eating hardly any vegetables. So I imagine that you ramp up to 9 cups a day. Don't just start with 9 cups a day.
Well, in my clinical trial, we start people, boom.
Oh, okay.
And I let them know that if they have change of bowel habits, gut issues, to back down. But because I take away the gluten in the grain, they're hungry.
Yes.
And so they're going to be eating, they generally eat those vegetables. I'd say the vast majority do well. I certainly do find that some folks have individual responsiveness that some people can't tolerate, 3 cups of greens. But they do fine with a cup and a half. or how they metabolize sulfur is probably different, and they don't seem to do nearly as well with the cabbage and onion family vegetables. And so maybe they're doing a lot of mushrooms and asparagus instead. So we do personalized things, but the program is where we start and then assess their response and help them make substitutions to get the same effect.
Yeah, and I think that that's an interesting point. We can look now at genetics for people that have more difficulty processing sulfur, or we can look at oxalate and sensitivities and things like that. But I think a lot of times you can just tell by the response, especially if you're making just one change at a time, and then modify that response.
The beauty of my having worked for 17 years in the VA is that the agreement was that I was not going to order any fancy functional medicine testing. I was just doing basically primary care stuff. And so I had to learn how to practice these concepts with the history and physical, some very simple labs, and assess response and make adjustments. And what I learned is, in fact, we could do a phenomenal job just doing some basic public health versions of the principle, and then make adjustments based on the clinical response. And so I'd say the vast majority of our folks did incredibly well with the diet and lifestyle recommendations, adjusted according to the person's individual response. And only a few times did people not do well. I mean, if people weren't doing well, most often it was because they were pre-contemplative. They just weren't ready to embrace all of these concepts. And those who were willing to embrace the concepts, the vast, vast majority had marked reduction in pain, improvement in quality of life.
That's great. One of my first jobs was in a public hospital in Houston, Texas. And, really, when you don't have all of these tools as your earliest job and, or where you've been for a long time, it really does teach you those clinical skills of being able to adjust to, patient response and that kind of thing. And I think that's so valuable because it allows these very simple but extremely effective tools to be utilized on a larger scale without a lot of additional cost.
Correct. And so you can present to people, in your practice, the choice of, let's do these interventions first, assess your response. If some folks, it was really quite wonderful in the VA. People, I covered them labs, and so the ticket to get to work with me was you had to be willing to do the protocol 100% for 100 days. If you weren't, and just want to sort of ease into it, you could work with our nutrition experts and improve the quality of your diet at the pace you're willing to. Or you could say, this is not the right time in my life. I just can't contemplate giving up my grains and sugar yet. And I'm like, okay, so, go back to your personal doc. Not everybody can beat their addiction. But give us a call when you're ready for some action.
That's great. So before we wrap up, I just want to ask you, what kind of research are you working on now, and how can we support that?
Oh my God, it's so exciting. It's a hard time sleeping at night, So we have two studies, big studies that we're involved in. The first one is the study that's funded by the National MS Society. People are coming in with relapsing remitting MS and fatigue. We observe them for 12 weeks, then we randomize them into either the SWANK diet, which was the original MS diet, low saturated fat, or the Wahls diet, which is the modified paleo diet. You have to have fatigue and you have to have relapsing remitting MS to be involved in that. Now, the other study is actually being done in Bastyr University. This is an online study, and here you can either have Parkinson's or you can have MS. And every 6 months, you fill out a bunch of questionnaires about your diet, your vitamins, your supplements, your quality of life, activity levels, and then you do a 24-hour dietary recall. And you can fill all this online. So what's really wonderful about this is, one, you don't have to be following the diet. You can follow any diet, and this will be very useful for those people who are pre-contemplative. This is so great. And those who are following the SWANK diet or the Mediterranean diet, or the Dougal diet, or the Wahls diet, this is really great. And I think there's 650 people in the study. They're going to recruit up to 1,000. And so we've been helping them recruit. we were able to double the size of the research study. So they have a lot of folks following the Wahls diet. And I'm just really excited to be able to begin analyzing that data as well.
Yeah, that's great. So the data that you've completed, what would be, the top two sort of take-home points that practitioners?
Well, so we have a whole slew of papers from the first study in progressive MS, and the key thing to tell everyone is we had people who were every bit as disabled as I was, who had marked improvement in progressive MS. Now we weren't able to improve everyone. We were able to improve fatigue, mood, energy, quality of life. That's the easiest. Gait takes longer to improve, and that might take the full 12 months to begin to see change, or it may take a couple of years. But the fatigue, pain, generally people could see changes within 3 months. It's not, by any means fixed, but they can see improvements initially. Get rid of and when we did the analysis for what was the important factor, diet, meditation, exercise, E-stim. Diet was the leading factor. It was important to eliminate the harmful foods. It was even more powerful with all the vegetables. And the p-values were less than 0.00001.
Oh, wow.
For the vegetables, and 0.0001 for avoiding the excluded foods. So, it's important to avoid the excluded foods, but the vegetables are also incredibly powerful as well.
And so for the practicing clinician who wants to even start to implement this, really the first step is just adding vegetables, which any practitioner can do, right?
Tell them to eat more vegetables. And then the second step, replace, get rid of the sugar, go low grain. If they can, go gluten-free. That'll be very helpful.
Great. All right.
And then for your practitioners, I want to invite them to think about coming out to my seminar and becoming certified as a Wahls protocol practitioner, because I'm training folks, and I would so like to have more practitioners get trained.
That's great. Do you do that in person or online?
We do it in person. This is our year that we've got that. It's in August. Okay. We have that seminar information on my website, so people can log in there and read all about what we've got going on.
That sounds great. Thank you so much for sharing that. And thank you so much. I think, it's really valuable for us to really start thinking about, especially those of us who see a lot of chronic pain, when autoimmunity isn't really the first thing that comes to mind. It really is a part of these things in a way that we haven't considered before.
Absolutely. I think it's more and more we're recognizing that autoimmunity, the autoimmune components, will be part of probably many, if not the majority, of the pain symptoms we face.
I think so. All right. Well, thank you so much, Dr. Wahls. It was my pleasure to have you here, and we'll hopefully see each other again soon.
That would be great.
All right. Take care.
Thank you. Bye-bye.